Can you introduce yourself and tell us something about your precision research?
I come from Adelaide in Australia. I work in the Lysosomal Diseases Research Unit there, and I head a group known as the CNS Therapeutics Group, and we're interested in trying to come up with treatments for MPS 3, specifically 3A. And along the way what we're trying to do is understand how the disorder progresses better. I think that's essential so that we can apply treatments to it in a coherent manner.
Is there a bigger population of MPS 3 patients in Australia, or is it just something that grabbed you, or is just...
Yeah, I'm not sure about how the incidence in Australia compares to overseas, but I sort of wandered into the field, but I'm thoroughly captured by it. It's quite unique because we have a chance to interact with families and patients, and that's not something that I think any of my colleagues experience anywhere else, and it's certainly very motivating to meet the families and the children affected by the disorder that you're researching. It gives you a hurry up, that's for sure.
Could you summarise what your presentation was about?
I was asked to talk about animal models and innovative therapies, and I actually chose to go more towards the animal model side of things rather than the innovative therapies, because there's a lot of discussion of new approaches at the meeting. My reasoning was, I think that we actually need to almost take a step back and ask what our animal models are actually modelling. Are they modelling severe, early onset forms of disease, or are they modelling the more attenuated forms? We need to understand that better and potentially create new models so that we can address all patient concerns. And I think although we've made great strides in testing therapies by administering them to pre-symptomatic animals to show that a therapy is worth following up on, that it's working, what we haven't done very well as a field, and I'm as bad as anybody else, is to actually ask in the present time when we're not newborn screening and the patients are presenting because of their symptoms and therefore going into trials with symptoms, we haven't actually asked of our therapies, are they able to reverse those symptoms? And so that was what I focused on in the talk, describing the few studies that have been done to try and examine reversibility of symptoms, and I guess try and give everybody, including myself, a bit of a push into that area, because I think it's going to be crucial to ensure success of treatments in patients. Of course, ultimately what we want is patients screened at birth onto the most appropriate treatment for them immediately to give them maximum quality of life. But at the minute that's not possible.
At this time?
No, at this time. Many people are working hard on both the diagnostic side, and I think that's not quite as much of an issue, how to diagnose, but it's how to predict who is going to have a very early onset form of the disease and who's going to have a type of disease that comes on later in adulthood, say. And it's very important to understand that before you actually give someone a diagnosis. It's ethical, I guess, to understand that. And it also means that you can then offer them the appropriate treatment. You either treat immediately or maybe it's best to wait if the treatment option is it has a safety concern associated with it. It might be wiser to wait if symptoms aren't likely for decades. So.
Okay. What do you think of the conference so far?
I've thoroughly enjoyed it. As usual, meeting families and patients is probably the highlight for me. I go home motivated. I'm going home to a lab that wants to hear all about the meeting and will want to hear about how patients are faring, and that will motivate them as well. So that's, as always, been an excellent part of these meetings.